Bring this month's and the first of this year's Support Services Committee meeting to order. I'll start by entertaining a motion to accept last meeting's minutes, please. Motion made by Supervisor Wild, second by Supervisor Sokol. Discussion? All in favor?
Aye.
Opposed? Carried. All right, since Ms. Vogel has taken the chair, we'll start with County Clerk.
Okay, good morning. This morning's agenda is very brief for the County Clerk. But we do have a vacancy in the Warren County DMV, and I respectfully request that we approve filling that vacancy. I've provided you with some of the details regarding the position. It is full-time. It's a grade 8. It runs at $34,988 annual, full-time. It's a full-time position with full benefits. It actually rounds out, there are 5 motor vehicle reg clerks in the DMV. That would be the 5th one. That is currently vacant. Eligible list from civil service will be canvassed for this position, and one of the things to note about the DMV positions, they generate tremendous amount of revenue for Warren County, and you'll note that we are up considerably in number of transactions in 2018 and as well as revenue. But that isn't the only thing. Tremendous work and effort and service to the people, not only in Warren County but our surrounding areas that come to us each and every day. So this individual, once we go through the canvass and the interviews, will also at one point in time be subject to an extensive federal background check in order to do the processing in the DMV for EDLs and Real ID. So that is it in a nutshell. There's a lot of work ahead of us to fill this position, but we respectfully ask that you consider this and approve this request.
A motion made by Supervisor Leggett, second Supervisor Hogan. Discussion? All in favor?
Aye.
Opposed? Carried.
Thank you very much, and have a great day.
Great day.
Stay warm.
Carla and Michael, rock, paper, scissors.
Morning. Morning.
I just have one on there today for Computer Reserve Fund. It's a little different than what was sent out. We had just one item that wasn't on there that went out on the agenda that went out last week for our camera for the county clerk's office. So it's a lot of money, but it's stuff we've already been setting aside for several years. It's already part of the budget. We just need to transfer it so we can start the project.
A motion get on the floor. Supervisor Sokol, second. Supervisor Hogan. Questions? Mike, would you explain that again? It's a lot of money. I missed a couple of the words in there. Where's it going?
So it's a lot of money, but we just need to get the money transferred. We can start our projects. We have some clocks replacements, some network server replacements, all planned for this year.
And why do we transfer it all at once, or it just comes into your budget and then you spend it?
Yeah, these are specific projects that anticipated costs, so we can start the bidding process to get those things going. I mean, there's a lot more money in the reserve fund, but we leave it until we actually need it, kind of thing.
That's a great program. Supervisor Leggett.
Thank you. Michael, the training laptops, those used for all departments or?
Yep.
Yep.
Yeah, we have a room over there with laptops. They're almost 10 years old, so we've been using them a long time, but various departments come in and use them for various trainings or whatnot that they need them for.
Yeah. And the time clocks, that's just a replacement as well?
Yeah, because we have time clocks are out there, and they reach a certain life that they're starting to just kind of lop off in large numbers over the last year. And we need them to keep the payroll system running, so we kind of anticipated, based on what we've seen, what we think is going to fail this year, to get them ahead of time.
Okay. Further questions? Supervisor Wild.
Chairman, thank you. Mike, the training laptops, don't most of our staff have laptops?
No.
They don't.
Everybody has a desktop.
Okay, I'm good.
Supervisor McGowan.
Yes. We did talk about those time clocks last year.
Mm-hmm.
They do the retina scan, the blood pressure test, everything coming in. And I know, like
You
you
do
said, I think
fingerprints.
we had a couple on the,
Fingerprints.
pardon?
Right, it's fingerprint time clock?
Yes,
Yeah,
the
yeah.
fingerprint, we have it all covered. And I know last year we talked about it, because, like I said, I think you were using the last one up on the shelf, and we wanted a couple more, so.
Yep.
There's no other simpler way of doing this?
Right now, we have a system that uses a proprietary clock, and we have a rule for ourselves that says we will use biometrics. So you have to get this clock. The price is what it is, because you can't buy it anywhere else. So we have to have those clocks.
I mean, the varios are signing in at the desk.
Right, it does have the ability that you can go to a website and punch in and out. That's there. But I guess that's a...
But it's all tied in with payroll and that, right?
Correct, yeah.
So, all right.
Yeah, if
I
they-
know it's a complicated, I know we talked about it, I just
Yeah.
thought of, you know, because they are expensive, but every year they become a little more obsolete, you know?
Yep.
So I was wondering if we were preparing for, you know, like everybody carries a key fob, so they know when they're in the building and,
Yep.
you know, when they're walking around and when they're leaving, so. All right, thanks.
Further questions? I have a question, probably not in your purview, but the IT is, when people punch in and out, are we still doing it on the 10-minute or 15-minute intervals?
That I
Or
could,
is it
how
by
it
the
rounds
minute?
off, that I couldn't tell you how
Okay.
how it calculates.
The hospital, they do, you
Yeah.
get paid by the minute, so if you punch in 2 minutes before, you get paid for those 2 minutes. Because
Yeah.
we can do it because of the electronics. Okay.
I believe it's 10 minutes.
10 minutes?
10 or is it by the half hour?
I think it's 10 minutes, yeah.
Have you tried this theory?
I do approve timesheets, and I see, point, ones and point twos, and so.
All right.
All right, further discussion, questions? All in favor? Oh, wait.
Aye.
Wait.
Hey, thank you, Mr. Chairman. I apologize for being a couple minutes late. So, are you saying that because of the fobs, we can track when people come in and out?
No. Sorry.
Yeah,
Sorry, Mr.
okay.
Chairman.
All right, just curious, the system's already set out to track everyone. Why aren't our directors and so forth punching in and out, or, you know, when they come and go? I mean, isn't that, the system's already set up for that, there wouldn't be any additional costs. So, I think from a security standpoint and safety standpoint, knowing when people are in the building and not in the building is very important. It isn't to track how many hours they're working or anything like that. It's more of a safety issue to me. I know when I worked at a Metro large building, I was vice president of operations. I had to punch in and out. They had to know where I was at all times because of exactly what I just said, safety and security reasons. So why wouldn't we do that same, expect that same for all our employees here at the county?
I'm not sure who would be answering that
I don't
question.
know either.
There's a point is made there, at the very least, there's a fire drill or for some reason we have to evacuate. I guess Amanda is for, at least Joan Sadie was, you were the go-to person for this unit here. And how would you know who's in the building and who is not?
Well, I know who's here now. We would go out, when we go outside, that's who we try to keep track of, is who we knew was here, before that.
Thank you.
Obviously, if there's someone in the copier, we would actually want to.
Thank you. Yes, right.
Yeah, in terms of the emergencies, as Amanda is referring to, all the department heads or their second in command who would be here in a fire drill, they will check once we assemble. We have set assembly points outside, and they'll check to make sure that all of the employees who we know are here are assembled. And if they're not, we have radios where we'll call around to say who's unaccounted for, and we'll track people down that way. As for why, the question why some of our employees are one punch, it's the employees that are FLSA exempt. It's a determination that's made by personnel and civil service. We're actually going to address this later on this month in the Personnel Committee. But essentially what FLSA exempt means is that you're not qualified for overtime because you're a manager. So the Board of Supervisors, I don't have the year, it's in a different folder, but when we set up the time system, established a list of FLSA exempt positions that only had to punch once That's the answer to Supervisor Beatty's question as to why that happens.
Further discussion, Supervisor Beatty?
And I understand why it happens, but it's easily correctable. Just because that's why it happens, Brian, in my opinion, I don't think that's the way it should happen. We're going forward, it should happen. And so, yeah, I understand that, you know, that's why it happens, but that doesn't mean it's a good system to have. One person punches in one time, and you know, I just think that knowing where our directors are, and other, non-exempt, people, is not only a safety concern, but it's just good practice. And again, I referred to when I was in private practice, private industry, that they insisted, that I was head of the whole thing, well, vice president, they insisted that they know where I was at all times, as well as every other exempt employee.
Supervisor
I
Leggett?
just don't understand the difference, why? I understand we can do it legally, but I just don't understand why we just don't solve it.
Okay, Supervisor Leggett?
Thank you, Mr. Chairman. Mr. Chairman, how many people are we talking about in that group?
I'm not sure, Ryan?
I think probably somewhere between, I would say over 50, maybe 50, 60, 70, somewhere in that neighborhood. I can get you the exact number.
Supervisor Garrity, would this be a question? Supervisor Garrity, would this be a question that we would address?
We'll take care of it at personnel.
Okay, thank you.
All the information there.
Very good. Any further discussion? We have a question. Motion was made by Supervisor Wild, second. Supervisor Hogan. Further discussion? All in favor?
Aye.
Opposed? Carried. Thank you, Michael. Carla?
Good morning.
Good morning.
So I'm not really asking for anything today, but I was asked by Supervisor Wild last year to kind of give an overview on how I handle when things come up where departments may not be following procedures correctly and what I do to handle that. So when I took the position of auditor in 2015, I think it was, it's been about 3.5 years. I know how I learn, and I want to know what my expectations are when I'm doing a position, when I'm doing a job. So that's kind of how I've approached my position as auditor, is I've made my expectations and the county's expectations as clear as I can to all the departments. Because when I took over, there was no training manual, there was no training guide. We have county policies, we have the purchasing policy, and it's all in these different places. And if somebody new, especially, is coming in and trying to learn the job, it's not always easy to navigate where to find all these things. So I approached my position as I want people to know exactly what's expected of them. Because how can I get upset at somebody if they don't know exactly what they're supposed to be doing? And it's government, and there's policies and procedures all over the place, and they're not necessarily very cohesive. So I approached that when I first started, in my first, I think it was my first year, I came up with a training class that I offered to all the departments, and I've attached some of the training materials that I came up with in the agenda packets that I handed out earlier. So you can look through those. I'm not going to go through all of them, but just to give an idea of what I provided to the departments, so that they have it easily accessible. And I work with them every 2 weeks when the audits come through. When there are issues in what people have submitted to me, we email them to let them know what the specific problem is. And if it's, a lot of times it's, well, your address is wrong, or this is spelled wrong, or, well, you typed in your code wrong. So most of them are pretty simple, basic human error, which happens, and we don't expect perfection of anybody, and that's why we're here. But when there is something larger that needs to be addressed, where maybe somebody isn't familiar with what the policy is, or how the policy is interpreted, or how it should be interpreted, then what we do in my office is we use the training manuals that we've come up with, the county policies, and also the state comptroller's manuals, and give them the reason why we're expecting them to do things a certain way. Because I want to train people so that they understand why I'm asking them to do something, not just me, the auditor, well, you need to do this. Because I like to understand why things are done, and I assume that other people feel the same way.
Very good. Questions? Supervisor Wild?
Thank you, Carla. Thank you, Mr. Chairman. There's a lot here, and I have to apologize. I did not go through this before the meeting. But I appreciate what you're doing, and I'm curious, this has been sent out to staff?
Mm-hmm. Yep,
So,
we had
any
physical
response?
classes. I did classes in the IT training room.
Okay.
On the one that you're looking at right now, in the beginning was the first class I did. And then Julie Butler and I, in 2017, did another class on the purchasing policy and contracts specifically. So we've done like face-to-face training, as well as when new employees come on, I send them this information. I go right to their desk and help them if it's not a larger department that has somebody that can already train them. You know, our phone rings all day long with people asking questions.
So Carla, you know, this is good, and I'm definitely going to go through this. What else do you feel you need help with? Is there anything that we can do to help you, to help the county run better, to make sure we're not making mistakes?
Mike, we only have another 10 minutes.
I know.
It was a quick question.
I mean, my big thing is people need to read the policies, and specifically within their own department. Everybody needs to be very familiar from the very beginning, getting the resolution, to when the contract is done, to when the invoice comes in. And everybody needs to read, they need to know what their contracts say, they need to know what the resolution says. So if, when it comes before you and the resolution may not be worded correctly, if it's corrected then, it doesn't get to me, and then has to go all the way back to committee and be corrected then and hold things up.
So, Mr. Chairman, if you don't mind, I'm going to try to be clear. So, I agree that people need to read the contracts. I feel that there's gaps in the organization in terms of how we manage our contracts, and it's something that I'll be talking about a little bit later today in one of the other committees. But how do we help support this? How do we reinforce that there's a lot of contracts and there's a lot of language, and we need to read it to make sure things are being followed? Because I've seen it in a couple of instances where we haven't been following it, and there's gaps, and people aren't abiding by the clauses of the contract. So you say we need to get people to read them. Are we going to have a study hall? You have to read your contract today. Let's read this one. Let's read that one. Let's make sure that that's happening.
I don't know if there's an answer to that. What I do, I look at the resolution index, like it's about a week before the board meeting, when all the resolutions are there in draft form. And I go through and I look at them and see, and I found a couple instances where I've called somebody and they're like, is this how you wanted your resolutions to read? Not very often, but sometimes I've found things that I didn't think was the intent of the department, and I pointed it out to them.
But I'm thinking more, and again, Mr. Chairman, I'm sorry, the ongoing execution of the contract, where, you know, we're 3 months into it, we're 3 years into it, and things have kind of slid, and people haven't been paying attention, and we're not abiding by everything that we should be.
If it's something that's a payment involved, and we have to look at it, you know, and there's cases all the time where I'm emailing the county attorney's office, I'm like, can you just check into this for me? I'm not sure if this is exactly right, and we've amended them. and I feel bad, you know, I'm constantly bugging, the county attorney's office, but, you know, we do amend things all the time to make sure that we are following what the terms are.
Thank you for this. Thank you, Mr. Chairman.
You're welcome. Further discussion? Questions? Comments? Okay, the county attorney and auditor work very closely in the development of contracts. Okay. There's nothing to vote on, no motions, but thank you very much, Carla. Appreciate it.
Thank you, Carla.
Excellent. And Carla's door is always open and her phone is always available.
Thank you.
Clerk,
Thank you.
Clerk of the board.
Okay, my agenda I passed out earlier, there should be one in front of you. The only thing I have is a request for out-of-state travel. Supervisor Simpson has requested to attend the National Association of Counties Legislative Conference in Washington, D.C., and that's on March 2nd through 6th. The National Association of Counties will waive the $750 conference registration fee because we're a new member. So the only cost associated with travel to and from the conference. A board resolution is needed to authorize this because it's out-of-state travel. But I would note that we would also be looking for your permission to go ahead and book the room and the flight for this travel while the prices, actually, their conference materials say that the room must be booked by January 31st if you want to get in their block. If we don't do that, then we're just subject to whatever rate anyone else is charging, which would be higher. And then, of course, the flight, as it gets closer, the flight price will increase. So we're looking for permission to authorize the out-of-state travel, and that will generate a resolution that will come to you at the February meeting, but I would like your blessing to go ahead and get this all set up.
Motion by Supervisor Wild, second by Supervisor Driscoll. Discussion? Supervisor Wild.
Thank you, Mr. Chairman. For Supervisor Simpson, if you don't mind. Matt, are you going to bring us any money?
Actually, there's, this is part of an ongoing effort that we've been involved in pushing the cell coverage issue with the, you know, parts of Warren County and beyond. All over the state, you know, that's a priority of ours in local government to get the cell issue figured out. So what it's going to take is interaction between our federal representatives, our state representatives, and local representatives, along with the FCC, to try to bring everybody together and have a summit with all the providers in our legislators. And we actually have a meeting with Senator Schumer on March 5th at 3 p.m. in his office related to that, just that issue alone. There's other people that I'm involved in, I've been working with. I know Supervisor Gary has been forefront of the cell issue, but Phil Farber in Hamilton County is also part of it. Steve Aquario is the one who's been setting this up for us, and he said that
Supervisor Driscoll.
Thank you, Mr. Chairman. This is the organization that we joined this past year, and it's headed up by a local guy, or is that?
It's from Lake George.
Yeah, Chance. Okay,
Chance.
good, okay, yeah. Good.
Yeah, I will comment that when you go down, you should talk to the people who organize these conventions. Ask them to speak to the probation people. I think Bob Iose is going to Southern Florida for his convention. Just a suggestion. Any, not a real suggestion, but.
So yeah, you know, that's just one part of it. I mean, I haven't seen the legislative agenda for that conference, but these meetings are going to be other meetings set up for us also related to the cell issue, plus then also the conference.
Further questions or discussion?
So you're going to lobby to have another conference here in Lake George?
Call the question. All in favor?
Aye.
Opposed? Carried. Anything else anyone would like to bring before the Support Services Committee? County Attorney, we do have. Sorry, Mary.
By the way. So you're pitching softball? Thank you. I want to be on your team.
That was pretty accurate.
Jim will hit her brother Matt.
Thank you.
I didn't want to miss it. The pressure.
It's
The
on
pressure
film.
thing.
agendas.
Ben, I'm happy to see the Patriots are in there, but I was really,
Well, you had some?
I really thought it was that call of the Saints was.
I didn't see that one. No.
I mean, that was a game changer. I mean, how they missed that.
Okay. Mary, go ahead, please.
My first request has to do with the legal assistant real estate position that we just filled in my office. As he came on board and we learned what his duties would be, we actually want to change the title to a tax coordinator because that fits more of what he's doing, and it's basically a civil service designation, and it'll dictate what kind of test he takes, and it's just a lot more accurate to call him a tax coordinator. So the motion would be to change the title from legal assistant real estate to tax coordinator.
Supervisor Leggett, second to that motion. Supervisor Driscoll, discussion. Supervisor Leggett.
And you ran through civil service with all this, looking through the titles.
Yep, this was actually a suggestion made by Trish Nenninger, the civil service director.
Further questions, discussion? All in favor?
Aye.
Opposed? Carried.
The second item on my list, we're actually going to wait and do that at Health Services, I believe, because we just received the invoices and the referrals, so we want to make sure Dee has a chance to look over those before we talk about it. And then the last discussion item regards litigation, so I would just ask if we can go into an executive session for that.
Motion for executive session, Supervisor McGowan, second by Supervisor Wild. All in favor?
Aye.
Carried. We're now in executive session. County attorney is all set in her portion of the agenda. We'll now move on to county administrator.
Thank you, Mr. Chairman. I have one resolution request and one informational item. The resolution request is to move $37,599.94 out of the Westmount Reserve and authorize payment of the same amount to a Medicare managed care provider called Today's Options. This provider was responsible for providing some services to individuals, I believe 4 individuals who were in Westmount Nursing Home. They determined that that overpayments were made. Now, typically, when there's an overpayment made, such a provider will simply deduct the amount of the overpayment from a future payment, if that makes sense. In this case, the provider did not do that because we don't own Westmount anymore. These were issues that were ironed out after the sale. Now, for these, the $37,000 breaks out in 2 different categories. $7,870 represents 4 claims for which medical documentation was sent to support these claims, but there was a reduction in the claim due to the acuity of the case. The second category, about almost $30,000, does not appear that the requested medical documentation that came from Today's Options was provided. Probably something that occurred right around the time of the sale when we were short-staffed in Westmount and the medical documents that were required were not provided. So that accounts for the $37,599. I want to thank Tammy DiLorenzo for doing a lot of work on this. For 2 of these patients are actually still at Westmount. Tammy worked with Westmount to gather any documentation that Westmount had regarding these 2 cases. She also went through the archives here for the 2 individuals that are no longer at Westmount and gathered up medical documentation. She submitted all of that documentation, and it was rejected on the grounds of timely filing. Have 120 days usually to appeal such a thing. And then there is a secondary level dispute process that Tammy also did the work for, and that also did not work out in our favor, again, due to the time that has elapsed. We have done it, that we've worked on this for months, have done everything we feel that can be done to not have to pay this amount. But in the opinion of Tammy and our county attorney and also the county treasurer, this is a bill that we're going to have to pay.
Questions for Ryan? Supervisor McGowan?
Yeah, I'm just a tad bit confused here. You know, we've taken about a $3 million hit on not billing what we were supposed to bill for, and if I'm wrong with that $3 million, please interrupt me, but, and now, we have found out that, you know, we gotta even pay more?
There are different categories of providers. There's Medicaid, Medicare, in this case a Medicare managed care company. It's a private sector company. You know, we provide the care, we file a claim, the company pays it back, and then they determine that there was an overpayment for whatever reason. So, yes, it's frustrating. Around the time of the transfer, again, there was not enough staff. In some cases, the training was deficient, and unfortunately, this is where we're at. It's not uncommon for transfers of nursing homes, skilled nursing facilities, to have these issues.
And we sold Westmont for how much?
Do you know the answer to that, Mary? Frank?
Geez, I'm not sure if that was
Yeah.
It was 2.4.
Yeah,
2.4.
Thank you.
Supervisor Wild?
Thank you, Mr. Chairman. Just a question of clarity. Mr. Moore, you used the word acuity?
Yes.
If I'm not mistaken. What is acuity?
Acuity refers to the complexity of the case. So if you have a patient that requires a high level of service, you can get, they call it a RUG score. Tammy, if you could fill us in on what RUG stands for.
It's a therapy assessment that's done. The UG stands for up and go. It's assessing a patient's ability to move, basically. So what will happen often in healthcare, and it happens in the home care division all the time, is and what happens is we've been paid for these claims. So we're not in a state where we have to, New York State is not a state where we have to send in medical documentation for pre-claim review. So they'll review that and then they pay the claim. They pay us, and then later they can review the claims. And they do this under Medicare, they do this under Medicaid, any payer. So in this instance, they look at the medical records that were sent, and they said, you know, we're going to adjust them because this is where we feel that patient's level of acuity was at the time. So this is very, like I said, very, very common in all aspects of healthcare. Where we're discussing this is usually, like in home care, there are adjustments made all of the time, but there's a pot to pull that adjustment from. No, that's not the case anymore because it's West now, so we're going to pull it from the reserve to pay those costs. The only way that you could appeal potentially those things is if you had a therapist review the records again. Usually they're right when they make that determination, and the adjustments, as Ryan said, the adjustments for those were quite small.
Just one other follow-up. What's the status of our reserve?
How much is in the reserve? I already have a note to myself to provide that answer because I asked myself the same question this morning and said, you know, I should probably have an answer to that. I will let the committee know.
Further questions?
If you don't mind, just one more. You know, along the same lines, Ryan, how much longer is our liability last? So how much do we have left, and how much longer do we have to make that last?
In terms of this scenario happening again?
All the different claims, yeah.
I think it's basically up to the provider. I don't know how long that Today's Options has been going on. It's been going on at least as long as I've been here, last April.
We're hopeful that this will put an end to the Today's Options. I will tell you that we're in the midst of a big audit for Medicaid. It's kind of the same thing. They'll send claims. We're in the process of gathering those records. Records were just found over in Warren Center for some of those patients. So they'll provide the records that have been requested. And again, it's something that they normally, you know, this is normal process of doing business in healthcare. Unfortunately, they're going to review the claims afterwards. So we have that Medicaid that's coming up. they have a period of time. I really think we're probably getting to the end of it now, because we did sell in 2015 and we're in 2019, so we're hoping, that we're getting to the tail end of it.
It's not uncommon in discussions to sell skilled nursing facilities, the idea that the buyer inherits any money that's coming to the facility, and as well as any liability that is left over from the facility. I can't speak to whether that was discussed here, but this, as I said, it's not uncommon for a transfer of this kind to involve some degree of run out that can take years, frankly.
Supervisor Leggett.
So to get this clear, we received $37,000 more than we should have.
Yes, correct, according to the determination of the provider, and we've been unsuccessful at appealing that determination.
Supervisor Wild, another question?
All set, thank you.
Supervisor Hogan.
Are we still in business with today's options?
Today's Options does do business with health services. We do technically have the same tax ID number at health services as we had when these were handled through Westmount. I suppose that it would be theoretically possible that today's Options could simply withhold this amount from payments to health services. We wouldn't want to see that happen, though, because we do have dedicated funding in the Westmount Reserve to pay for costs like this, rather than having it come out of the operating budget if it was simply revenue withheld from health services.
Further questions on this issue?
Just,
Supervisor Leggett.
again, for clarification, this is almost like just a budget adjustment for things. You know, there was an overpayment.
Yeah. Typically, this would have been recouped out of a payment that they owed us for a different patient, but because we don't own the facility anymore, it can't happen that way.
Yes, sir.
Thank you, Mr. Rowe. Just as a note on Westmount and something happening right now, as you might recall, there was a delay in Westmount being sold to to Centers Healthcare, and no one could really understand what the delay was. I mean, initially, some people, including myself, were challenging the sale, but that had long since been taken care of, and we couldn't understand why there was a continued delay. What we then found out was that, for some reason, Mr. Rosenberg, who had sat in front of us and, claimed that he was going to be responsible for all the bad things that we heard about his other homes, and come to him, took his name off of the project, inserted an employee of his named Mr. Greenberg, and the sale then went through the next month at the Department of Health with Mr. Greenberg's name on it. Now, what we found out later, which was not available to the public at that time, is that Mr. Rosenberg had several IJs against him. Those are immediate jeopardies at both Washington County home that he owns and Essex County homes that he owns. And that is about the only thing that will make the Department of Health say, we will not transfer this to you. So that held it up for a considerable amount of time, which could account for a lot of this time. Now, the interesting thing that's happened is just a couple weeks ago, I got notice that Mr. Greenberg is asking the Department of Health if he can transfer 51% of his ownership to Mr. Rosenberg for a total of $10. Now, if this isn't a scam on us, perpetrated on us, to go ahead and say, when the Department of Health would never have sold it to Mr. Rosenberg, he puts it in an employee's name. He's done this before. And then, a couple years later now, for $10, he's taken it back in his name. That's the kind of people that we sold it to.
Further comments, questions? Supervisor Hogan.
Do you know what happened to those other, what do you call them, IJs?
They got in Washington County and Essex County. The maximum fine per event is $2,000, which is like, pocket change. They were actually fined, I think it was Essex that got fined $8,000, and Washington got fined $2,000, or maybe it was vice versa. But the outcome of that was 2 fines totaling $10,000 for these immediate jeopardy conditions that I documented, which didn't show up in the public notice for months after the sale is completed.
Supervisor Wild.
Thank you, Mr. Chairman. Travis, are you implying that the county has some obligation that we should interject ourselves into this current transfer?
I myself am going to, I went to the hearing when this was transferred, along with Peter McDevitt. We sat there in Albany waiting for our turn, hours and hours, waiting for our turn to comment on this. And when we did, and we started, the first time we mentioned Mr. Rosenberg, actually I think Mr. Garrity was in New York City at that time, and he was hearing all of this stuff, along with Mr. Paltrowitz. And when they did allow Peter to speak for a couple of minutes, and our concerns were this last minute change from Rosenberg to Greenberg, and we were questioning whether there was any additional information available that would explain why this condition occurred. And my other concern that I had is that Mr. Greenberg is an employee of his that makes, probably $100,000 a year or something, which in New York City ain't much. And yet they were going to entrust a multi-million-dollar facility to this employee. And normally you have to show that you have the wherewithal to support this, and I question that.
Supervisor Wild.
Just to follow up, maybe it's from Mary. Does the county have any obligation that we should interject ourselves into this? Because it sounds like it's a Department of Health issue now, and not necessarily a Warren County.
I'm not sure. I don't know all the facts, and I don't actually know the situation that Travis is talking about, so I don't know.
And maybe then for our chairman, is this something that we should interject ourselves in because they're our residents?
Well, I've asked we'll put it to the committee. Is it something you would like us to follow up on? That's a question, but what's your feeling on that, Supervisor Wild?
I think we need more information.
Yeah.
Right. Because,
Supervisor Leggett.
Up in North Creek, there's a nursing home up there, and that changed hands, but the county didn't have, didn't insert itself in that. With Westmount, we were previous owners, but, we did sell it.
True.
In the past, yeah.
Perhaps we could ask the county attorney to look at options and what the responsibilities may or may not be, obligations to the public. Yes, sir.
Thank you, Mr. Chairman.
Where's my memory?
I'd like to just give my 2 cents on this. It was probably the worst day that I've been a representative on this board in 5 years. The day we sold Westmount to Greenberg, not Rosenberg. He came up here, Mr. Rosenberg, and did a dog and pony show. Now, I've sat in hundreds of board meetings and seen CEOs, presidents of companies do song and dances. He came up here, and for 3 hours, he told everybody how he was going to be 100% vested. He would take care of our seniors because that's important to him. He went around the room and told everybody he was going to do that. We were allowed one question apiece to ask him. But he had to leave. It was a Jewish holiday, and he had to leave. So he got his time in. He snowed 90% of the board. Was totally disgusted at the board's performance and their lack of any type of savvy and knowledge. Mr. McDevitt was refused to show a video showing how an individual in one of his homes was killed, and the granddaughter, which was shown to 10 million people in New York City, but we were refused to even look at the video. So what happens? The board says, yeah, let's sell it to this guy. He's a good guy. He's a good man, that Rosenberg. He's going to take care of our seniors. So let's fast forward. We're a 4-star facility. We're now a 1-star facility. We've had an individual die in an accident in a van. We've had his employees marching and striking for better pay conditions. I personally went to the center's home 4 weeks ago, sat down with a friend of mine. His brother happens to be in the Stanton Center's home. He wanted a ginger ale. He hits the button. 38 minutes later, someone comes and says, I'd like a ginger ale, please. She says, okay. I leave 3.5 hours later. It wasn't a ginger ale. She never came back. Now, my friend went and got his own brother a ginger ale, but they didn't know that. This is the type of standards that we have for our seniors now, that we, not everybody, but a lot of people in this room said, he's the guy. He'll do us justice. He'll take care of our seniors. I was so disgusted that day, I almost wanted to get out of politics, because I didn't want to be in conjunction with some of the supervisors in this room, if they wanted to treat our seniors that way. Now, I'm a little passionate about it.
Excuse me, Supervisor Beatty, perhaps this would be a discussion of the Health Services
Well, perhaps it could
Committee.
be, Mr. Chairman, but I'm not done, thank you. So, you know, the fact of the matter is, when we start making these decisions so lightheartedly, and we get snowed by people so easily, and I can give you Siemens for another example, that we gotta start upping our game around here. We gotta be a little sharper. We gotta be a little more in depth. We gotta be a little smarter. So, now, I'm done, Mr. Chairman, thank you.
Thank you, Supervisor Beatty, for your in-depth comments. Supervisor McDevitt.
Yeah, since my name was mentioned, let me just kind of, maybe just say a couple of quick things if I find okay. I was not opposed to the sale of the nursing home. I was opposed to who we sold it to, okay? So, I was always of the belief that Port Hudson was the clear-cut choice that had been shown over many years, that they had shown compassion, care, and dedication to senior citizens. So, not opposed to the sale of the nursing home, but opposed to who we sold it to. Travis and I did take a day. We went down to Albany. We had an audio conference in a room down at the Empire Center. We sat there for 6 or 7 hours, and we were audio conferenced into a hearing in Manhattan. The board in Manhattan, they have 30 different projects in the state of New York, which they're approving that day. Millions and millions of dollars of healthcare facilities that were all approved. I was given an opportunity to speak for 3 minutes and 45 seconds, and I think Travis, I think they got it 25 or 30 seconds.
Yeah.
Okay. Travis, you know, so we spoke. We thought we made a contribution to an effort at taking care of our senior citizens. So that being said, I think it's important that we, as just citizens in this county, I've been over to the facility, West Mountain facility on a couple of occasions, and just in an effort to listen to the relatives of the patients at the facility. So I think it's incumbent on all good people to just stay aware of the fact that how as much as possible our senior citizens are being treated at the Warren Center. So that's my piece. Thank you.
Okay. Further discussion for the county administrator? Okay, any other discussion for the support services?
We had a motion in a second, and we didn't vote on it.
Oh, we have a motion. There is, what are we moving on?
Oh, I'm sorry, okay, the initial request, I guess there was no motion, my apologies, was for, the sum that I mentioned, let me get you the exact sum again, $37,599.94, to be, appropriated from the Westmount Reserve and utilized to reimburse today's options for claims overpayments resulting from post-payment claims review.
Has that been moved?
Motion? That has not. Motion made by Supervisor Wiles, second. Supervisor McGowan, further discussion? All in favor?
Aye.
Opposed? Carried. Any other questions for the, yes, Mr. Bryant?
I have a brief informational update.
Go ahead.
I'll keep it brief. Several supervisors have asked for a report on FOILs since the county administrator's office took it over, so to speak. We are the central repository for FOIL requests. We've encouraged individuals in the public to use the county website. We have a template to submit FOIL requests. However, we will accept them however an individual wants to submit it. We've asked all the departments to keep us aware of any FOIL requests that they get so that we can monitor the response. So Christy in my office keeps a detailed spreadsheet. We number each FOIL. Each FOIL has a unique identifier so that we don't lose track of it. We record the date received, the person who submitted, the submittal method, the subject matter, the department to which it's referred, if my office doesn't handle it directly in terms of putting the records together. We keep track of the date of initial response, the date of subsequent response. In some cases, we'll acknowledge the FOIL, and if it takes some time to put the information together, we have another period of time in which we're able to do that. And then we'll also keep track of the date that any of our FOIL determinations were appealed, as well as the determination date and the response to that appeal. So far, since we began this process, the board meeting in August last year, August 17th, we've had 128 FOIL requests come in over those 5 months. 124 of them, as of Friday afternoon, were complete. 4 were pending. 0 appeals. 22, in terms of the frequent flyers, if you will, 22 of these FOIL requests came from a private law firm. 19 came from a private citizen. 6 came from another private citizen, and 4 came from newspapers. And after that, it's 1 here, 1 there from individuals as well as organizations. 69 out of the 128 FOILs utilized the website template. Others came to us through different means, and we'll accept, like I said, however they come in. Responses, these are calendar day, they're not business day responses. 23 of these FOILs were satisfied the same day. 20 were satisfied within 1 day. 48, this is additional to the 23 and the 20, 48 within the first week. 12 within the second week, 10 within the third week, 5 within the fourth week, and 4 within the fifth week. So I was very proud to see these numbers. I think Christy, I give her a lot of credit for doing a lot of the work on this. She's doing a great job. And once again, thank you, Tammy, for all the work you did on today's options.
No pie chart?
Graph?
Supervisor McGowan?
Oh, no, I was just,
Anything else, Ryan? Did I miss anything? Okay, anything else come before the Support Services Committee? Okay, I'll entertain a motion to adjourn. Supervisors, Driscoll? Second by Supervisor Hogan.
Had to wait for the hat.
All in favor?
Aye.
We are adjourned. Thank you very much, folks.
Thanks, Matt. Thanks for coming.
Thank you very much.